Joining me now is the White House Coronavirus Response Coordinator. It's Dr. Deborah Birx. Dr. Birx, welcome back to Meet the Press. You heard from those frontline medical workers. I know you travel the country speaking to a lot of these frontline workers. Do you understand their frustration now when they feel as if they're at their wits' end? They've been pulling the double and triple shifts. They've been working so hard for 8 months, and half the country's not paying attention.
I understand it completely, and it's been a privilege to meet with them from the Billings Clinic in Montana to across this great country, to meet with healthcare workers and hear their frustrations, and also meet with communities and hear their frustrations. And I think we have to come together with a joint understanding of how this virus is spread and how we can prevent the spread.
What would you say to those healthcare workers? You're saying this, you're wearing a mask now indoors. This is the new CDC guidance if you're not in your home. So I think I totally understand why you're doing that now. Yet the White House and the State Department are throwing indoor parties all this month. I mean, as you know, this mixed messaging that the country's been getting, you say one thing, Dr. Fauci says one thing, and the president does another.
I think it's really important that every single person understands that the way this virus is spread is if you're with anyone indoors without a mask, that's a viral spreading opportunity. If you're outdoors and hugging and kissing individuals, that is a viral spreading opportunity. We have to really understand how contagious, how infectious this virus is. And it's really important at this moment in time that everyone understands also how much virus is out there. There isn't a state without increasing cases right now except Hawaii. So this is where we find ourselves, and we have to listen right now to what we know works, which is mask, physical distancing, washing your hands, but not gathering. You cannot gather without masks in any indoor or close outdoor situation.
I don't mean to belabor this point, and I understand your frustration probably as a public health official being asked about what is happening on the political side of things. But the fact of the matter is, we've been through this for 8 months now, and you have given us all these warnings. And again, the president and others in the administration just flout them. And so do you understand why some in the public then say, well, if he doesn't think it's a big deal, I guess maybe he thinks all the health people they're overdoing it. They're overselling it.
You know, I've heard that personally. When I go out, I just don't meet with healthcare providers and governors and mayors, but I also meet with community. And so I hear community members parroting back those situations, parroting back that masks don't work, parroting back that we should work towards herd immunity, parroting back that gatherings don't result in super spreading events. And I think our job is to constantly say those are myths, they are wrong, and you can see the evidence base. And right now, across the Sun Belt, we have governors and mayors who have cases equivalent to what they had in the summertime, yet aren't putting in the same policies and mitigations that they put in the summer that they know changed the course of this pandemic across the South. So it is frustrating because not only do we know what works, governors and mayors use those tools to stem the tide in the spring and the summer. And this fall-winter surge is combining everything that we saw in the spring with everything that we saw in the summer, plus the fall surge going into a winter surge. And I think that's why Dr. Redfield made this absolute appeal to the American people. This is not just the worst public health event. This is the worst event that this country will face, not just from a public health side. Yet, we know what behaviors spread the virus, and we know how to change those behaviors to stop spreading the virus.
What states right now, what governors, talk to them right now, what states that would you like to see increase the mitigation efforts right now?
You know, all the states are trying to do something, and I don't want to be critical of any governor and mayor. I like to talk to them one-on-one where I can be very direct and really have a joint understanding of what their data is showing. But every state across this country needs to increase their mitigation, and every state needs to be critically informing their state population that the gatherings that we saw in Thanksgiving will lead to a surge. It will happen this week and next week, and we cannot go into the holiday season, Christmas, Hanukkah, Kwanzaa, with this same kind of attitude that those gatherings don't apply to me. They apply to everybody. If you don't want to lose your grandparents, your aunts, let's be clear. If you're over 70, 20% of those over 70 who contract COVID are hospitalized, and still 10% of them are lost. So if you have anyone in your family with comorbidities or over 70, you cannot do those things. You cannot gather with your mask off. You cannot hug and kiss people outside. We won't have a vaccine for even the most vulnerable Americans. I'm thrilled with the vaccine.
Right.
But we won't have them for the most vulnerable Americans until February. So we need to do this now. Yes, the nursing homes will be vaccinated, but there's 100 million Americans that have these comorbidities that put them at substantial risk.
Talk to me about the hospital systems right now. How close are some to breaking points? And what does breaking point mean for the average person watching right now?
I think what's really critical for people to understand is our hospitals normally in the fall and winter run between 80 and 90% full, just caring for our routine health. So when you add 10, 15, 20% COVID-19 patients on top of that, that's what puts them at the breaking point. Because our normal healthcare system runs at 80 to 90% full throughout the fall. Now, I have seen, and part of the reason I've traveled, I've seen really successful examples. And that's part of the reason of going out, is to find out what is not working, but what also is working. We've seen in Chicago, Illinois, hospitals come together and create a unified dashboard. So they know at any one time for every single patient that comes into the emergency room, where there is a bed that serves the needs of that individual patient. We've taken that across the states so that they understand how to do that same kind of sharing and dashboard. And so there are good examples that can help preserve the lives of others. But I want to be very frank to the American people. The vaccine's critical, but it's not going to save us from this current surge. Only we can save us from this current surge. And we know precisely what to do. So if you have loved ones that you want to protect, you have to follow these guidelines now.
As the CDC came out very late, about a week before Thanksgiving, and advised against travel during Thanksgiving, are we going to get travel advisories for Christmas and New Year's sooner than what we got before Thanksgiving?
I think they're already saying that. I think they've made it very clear about how dangerous travel is because it mixes households. And I think what we've learned over the last 8 to 9 months is how significant this asymptomatic spread is. And that's the silent spread. Those are individuals who are younger and just don't know they're infected. And so they're passing on the virus. And so we've called on every state to increase their testing, particularly for those under 40, so that you can find that asymptomatic spread before it infects their aunts, their grandparents, their uncles, and really stop it. It's what universities did. We have examples now, very clear examples. Yeah. Universities that tested 100% of their students on and off campus at least weekly infected less than 1% of their student body. When you tested the way United States is testing, symptomatic, contact tracing, some surveillance, 10% of their student body became infected. So we have an example how important testing is as part of this whole public health response, along with masking, physical distancing, and our hand hygiene, and stopping our gatherings outside of our households.
Dr. Deborah Birx, the response coordinator for the Coronavirus Task Force. I'm going to leave it there. I appreciate you coming on and sharing these dire warnings. I hope your boss also hears the same dire warnings that you're telling the rest of us. Thank you for coming on.
Thank you for having me.
Hello from Washington, I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.